Hi, I'm Pam Bell. I'm the clinical specialist for the NICU, and I'm going to talk to you today about the neonatal code cart. The code cart has been refitted to comply with the Neonatal Resuscitation Program 6th edition guidelines, and you'll notice that there are a few things different about the cart. I want to reiterate that this cart is the neonatal code cart, which is different from the Broslow cart, which has also been recently refitted. So I want you to know that this is still the cart that's located in all areas of the birthplace, in the OB/OR, in the newborn nursery, in the LDR area, and in the NICU. I want you to remember that the neonatal code cart is not to be confused with the Broslow cart, which is for all pediatric emergencies, and we also have a Broslow cart in the Family Center supply room. So this is a neonatal code cart for neonatal emergencies on the birthplace. So the first thing you'll notice about the neonatal cart is that there's a red bag on the top. The red bag is an airway bag, and in this bag you should find everything that you need to deal with airway emergencies. And if you think about it, most of our neonatal emergencies have to do with airway apnea, choking episodes, so we decided it would be a good idea to put the airway bag on the top of the cart so that you can access that very first thing. There's a few items on the airway bag in the airway bag that you may not be familiar with. The first one is the NEO-T, and you've had some education on this device. This is a T-piece resuscitator. You'll find that in the bag. Probably the most important change is the pulse oximeter probe. This is in the airway bag, and this is for use for all babies that are needing oxygen during resuscitation. So as soon as you have a baby born that's having respiratory issues, you should have a pulse oximeter on the baby's right hand. Remember, right hand over the heart. The pulse oximeter on the right hand gives you a great idea of the blood flow to the baby's brain. The next item you'll find is a PEEP valve. The PEEP valve goes on the end of the ambu bag or the resuscitation bag, positive pressure device. This is used for very tiny preemies or babies that need some help keeping their alveoli distended, a little bit distended at the end of respiration. So any baby that's having some respiratory distress, especially the tiny preemies, may have this on the end of the bag. We have a little sucker, which is basically just a baby Yankauer device. We have a PD cap now in the bag, which is a CO2 detector. The CO2 detector, as you remember, goes on the end of the endotracheal tube and ensures that the endotracheal tube is placed correctly. And one last item is the replogal tube. Replogal tube is used for babies with tracheoesophageal fistula. It's placed the same way as an orogastric tube, but it's a little bit bigger and can be used for continuous or intermittent suction for those babies. The last item is the LMA device, and LMA stands for laryngeal mask airway, and the laryngeal mask airway is our alternative airway device for babies who we cannot intubate for one reason or another. So that is your airway bag on top of the cart. The next drawer is the medication drawer, and that medication drawer contains a med box. That box can be removed and placed right on the code cart. That drawer can be closed, and the next drawer contains all of your medication administration supplies. So you'll find IV fluid, syringes, you will find blunt needles, and you will find stopcocks. Also in this drawer is a calculator, and there are a few extra items just for vital signs if you need electrodes for the monitor, if you need another warmer probe cover, that's in here, and also a thermometer. So just a few extra items that are located in this drawer. The third drawer contains all of your items for umbilical catheterization, So that would be if you're proceeding on with med administration and you need to put a line in, your line supplies are here. We also have a bag full of items to start a peripheral IV, and we also have a bag full of some selected lab items, just a blood culture bottle, some heel stick devices, and a few tubes, just in case you need to draw some labs, and an ABG syringe for your arterial blood gas. The last section of the cart is for air leak or pneumothorax, and that contains 2 bags full of your needle aspiration kit items, and also a Heimlich valve. And the Heimlich valve is a one-way valve that will safely let you transport a baby back to the NICU with your cannula in for needle aspiration. Also on the bottom of the cart is some IV supplies, a burette, and some IV fluids, just in case you did start a peripheral IV. So again, I want to remind you that this cart is different from the Broslow cart. It's the neonatal cart located on the birthplace for neonatal emergencies and codes. And if you have any questions or issues or have anything that you feel that is not on the cart that needs to be put on the cart, you can call me at extension 4520. If you open the cart and you need to get a new cart, call sterile processing at 3549, and they will always have a cart ready to exchange once you've used the cart. Keep in mind, even if you only open the airway bag on top of the cart, that you'll need to get the entire cart exchanged by sterile processing. So if you open anything on the cart, please call sterile processing to get the whole cart exchanged. Again, any questions, please call me, and thanks for watching the video today.